Well, I personally think that the CRT is one of the gold stars of Tulsa, honestly, and the work that they're doing. I think last year the mayor gave CRT a proclamation saying as much. I'm sure you all think the same thing, but why do you think it is? Is it the reduced hospitalization? Is it the reduced utilization of services and first responders? Is it better public safety? I mean, if you were to name a couple things that are like, this is why I think this is such a great model, what is that, in your opinion?
I think for us, besides the 911 response, the crisis response, and having the different disciplines in the car and the things we've already talked about, I think it's finally looking at an issue. How many times are we going to these calls? What are the root causes for 911 response to health calls? And the most important thing I see out of this is the back-end navigation that Amanda already spoke of. It's not a one and done. The traditional response with police was going out and just leaving someone out, and they're not stabilized. They're just left in their home with no resources, or they're taken to emergency rooms, or they're taken to jail because jail's a quick turnaround. So we really moved away from that to diversion programs. And I'm really proud about the Tulsa Police Department because our training is really high. And I think any patrol officer can go out and know what to do on a crisis call. We give them additional tools and resources and the follow-up that's so important. So someone's going to start falling off into a black hole. Okay, we stabilize them, we're gone, and a week later they're in the same situation. We have now this back-end follow-up where COPES and Family and Children Services have dedicated teams, and there are back-end navigators to all our co-response models, and then they form their own team.
Right.
Yeah.
And so I think that's what's so important about these co-response models.
I also think about, when I think about what makes the community response team so unique and the gold star, people were calling 911 in a mental health crisis or behavioral health crisis, and they're getting experts that have great tools to use, such as police or the fire department. But now we've given them an extra set of tools. We're putting that mental health professional in the car with them to arrive on scene. Just because someone called 911 and didn't know to call mental health professionals, now we're providing that to them.
Right. Immediate response, yeah.
Right care at the right time.
Yeah.
Stress and mental health is identified as one of the top 3 issues affecting Tulsa, and identified in the community health needs assessment. And things like this, the community response team, have been innovative ways at directly addressing the needs that are affecting our community. This puts great people together that are experts, that this is what they do every single day together, and addresses that and responds to those people in need. COPES follows up back in. This helps things on many levels, from the system perspective to the human perspective, just the individual. Teams like community response team and co-response teams are force multipliers in cities.
So how many days a week is CRT working?
They work 5 days a week, basically Monday through Friday, business hours. So 8:30 to about 4:30.
Yes, so we applied for a grant, Connect and Protect, and we received it. But Family and Children's went above, as they always do, to partner with us and not just hiring one person to put in a division. They matched that. So we were having a gap after those business hours. And this is a model that's used across the country too. We embedded a clinician at each patrol division. So in Tulsa, we have 3 patrol divisions, and we embedded them for the afternoon and evening hours. And they're in a designated geographical location. So it really cut the city in thirds. CRT responds, it's one unit that responds to the whole city. IRT, it's in thirds. So it's tripled the response right there. And the clinicians have learned to talk on the radio, to look at police calls.
They know all the acronyms.
They're learning all the 10 codes. And so it's really great. And, the police department, I was getting calls like, when are they starting? When are they starting? Oh. It's something that's really well received and wanted by officers. They want that expertise out there with them, so they can make just the legal judgments and allow the clinical judgments to be made by those mental health professionals. So they operate from 1 to 9, Monday through Friday, Some divisions are a little bit different than that, but that's generally the schedule. And they go out and they're available at any time on request. Now, they don't go out to calls by themselves because we have to address the safety issue since it is a 911 call, but they are available and it's been really well received.
Oh, I'm so glad. And the alternative response team is doing the same thing too. Can you explain that a little more, Justin?
Yeah, absolutely. So the alternate response team 1 is what we call them. It's a slightly different model than the community response team in that it has a firefighter paramedic who is CIT trained along with a COPS clinician for Family and Children's Services. They respond and employ very similar to community response team in regards to their self-dispatching, their monitoring CAD, and that's anything that comes through the fire side or police. They're looking at the system and seeing appropriate calls, much like the community response team does. And to echo what community response team does, they do a really good job of finding calls that are appropriate for them to go to where they're providing that value. And so ART1 responds to those crisis response or behavioral health crisis. They also respond to what we call just 911 high utilizers or people who are calling 911 a lot to try to get assistance through the 911 system. So if a fire truck's on scene with an individual who's maybe called 911 20, 30, 40 times, and they can call for ART1, and we've really seen significant value with getting a clinician on scene and beginning those social services and that social psychosocial assessment to begin moving that ball forward, because we've operated another program and just really success rate for connecting with that individual is fairly low. And so ART1 is able to kind of bridge that gap and get those people the help they need. And so this has been really significant. And so ART1 has those staggered hours as well from community response team. It's operating Monday through Friday from 10 to 7. And so they're roaming around the town, though, and looking for ways they can provide value through crisis response as well as behavioral health, 911 high utilizers.
Are there other communities looking to Tulsa to model after us? I know that, we went to Colorado Springs and really took a close look at what they were doing there. It feels like we're doing such innovative things to solve problems here. Are there others that are trying to model after us?
Yeah, one in our own state, Oklahoma City.
Ooh.
Oklahoma City's very soon will be deploying some co-response models, multiple teams actually. And so they have taken a lot of the language from us and lots of conversations. Amanda, you were on one of those.
And it just reminds me of, we were just doing a presentation when we were in Omaha, Nebraska, and they reached out and asked to meet with us about our co-responder models while we were there. So we had a meeting just while we were there 2 weeks ago.
Yeah. We're very fortunate. We have a couple of different models here with CRT, IRT, and ART1 that we can look at these from different lenses in different ways. And what's great about it is even while we're doing this and we're continuing to grow and find new ways to improve these situations, they're operating very well together, all these teams. I do think that speaks to the two people to my left, very innovative, very forward-thinking, and really looking for answers and not problems or reasons why we can't. And I think that's why we are where we're at today. But Oklahoma City's one. We talked to Omaha. Speaking of, we had conversations with them about expanding out. So I think it's a very exciting time for co-response, a very exciting time in addressing crisis response in our nation and what's some of the best ways and methods forward.
Yeah, I think this has been such a problem for so many years. This does feel like something that's moving in the right direction, and it's just so exciting to talk about such great innovation used to solve such huge problems.
I just love to be able to listen to all the different models and hear the different pieces. And it just brings me back to what you said at first. It's us having the communication to be able to figure out what model works for our community, and that there may be numerous models that we need, and how do we work together to implement those. And I just wanted to bring that back, that you'd said that even in the beginning.